so much, Gordon. It's really fun presenting about this project that we're doing. This is the first time I've presented on it. It's still very new, but I'm really excited to speak about it with all of you because for all of you on the call, you are our principal stakeholders in this exercise, and I'm so excited to have the opportunity to let you know about it and hopefully encourage your committees and your institutions to participate. I've noted that I'm on Mooninya land. This is just a beautiful shot of my son when he was much younger, and Nipaluna, Hobart, which is just a spectacular place to live and work. And I'm very grateful to be able to live on such beautiful country. So a little bit of background. I mentioned that I work for Bellbury Limited, which is true. Bellbury is the host and one of the founding members of CTIQ, which is an Australian member-based organisation that seeks to develop and implement recommendations to improve the impact, quality and efficiency of clinical trials. We've done about 12 continuous improvement projects so far. Our most recent, which I think many of you will be aware of, is a revised participant information and consent form as a template nationally for Australia, which manages to get things down to about 12 pages, but more importantly, also be easy to navigate, have white space, have visuals, and layered approaches to providing information. But I'm going to talk about a different project here, which is one we started this year in partnership with the Australian Research Data Commons, or ARDC. The project seeks to develop resources for the research sector on how we deal with the governance issues relating to the sharing of clinical research data, in particular when we don't have clear consent for that sharing. We have 4 parts of this project, which we commenced in April of this year. The first is to develop a governance framework. Pretty clear cut, just trying to let everyone know what the rules actually are in the different states and territories, as well as nationally, give some clear understandings of who's responsible for what, as we try to work out what's the role of an ethics committee or an ethics review body, what's the role of research governance, what's the role of data custodian, how do all of these fit together, and hopefully try and streamline and make everyone feel really confident in the job they're undertaking in that space. We've just completed a round of consultations with the sector on the barriers and enablers to sharing clinical research data, and we'll be releasing that consultation report very shortly. But it's this work program 3 that I really want to talk about today, which is the shared ethical debate component, to try and get a sense of where our ethics review bodies are falling in the way that they're considering the review of research proposals seeking to share clinical research data, and bring that together to allow some self-reflection among ethics committees themselves, as well as give additional guidance to researchers on what they need to be considering to put together a robust, thoughtful application when it comes to the sharing of clinical research data. For those of you who haven't come across this term before, we didn't make this methodology up ourselves. Shared ethical debate is a tool that was developed in England by the Health Research Authority as a means of improving consistency with their research ethics committees. And the philosophy that underpins shared is this idea that there's going to be a certain level of inconsistency. And I think we all agree, and as Holly beautifully mentioned, we're talking about standards, not rules. We're talking about principles. And we can never and would never say that variation in decision-making is a lack of quality, right? I think everyone accepts that as fundamental to the raison d'etre of having ethics committees. But what we can do is try and understand how much inconsistency we have, understand why we have this inconsistency, and then determine to the extent possible what level of inconsistency is acceptable in these given areas. Shared works somewhat analogously to a secret shopper exercise, except it's not secret. Reviewing committees are asked their consent for whether they're willing to participate in the activity. They get sent a dummy application, which is very clear. It's a dummy application. You don't have something on your committee agenda which you think is a real application, and whoa, all of a sudden that wasn't a real application at all. Camera coming out from behind the curtains. And the de-identified minutes are sent back. and a content and thematic analysis is performed. Importantly, and I'll talk about this a bit later, aggregate results are also returned to participating committees for their self-reflection. Okay, so it also provides a learning opportunity for committees to get a sense of where other committees are falling in this shared space. With the project that we're doing, we've added a little bit onto this to optimise it for the particular piece of work that CTIQ and ARDC are doing. So for any of you who are invited to participate, and an invitation will be sent to the executive officer listed for all HRECs registered with the NHMRC. The first step is a survey about experiences, barriers, and enablers for reviewing research proposals. Now, you are completely welcome as a committee to just do that bit and not do anything else. We know how time poor committees are, and this is really to get a sense of what tools ethics committees and their institutions feel they need to support them in reviewing these secondary sharing applications, which I know from having chaired an ethics committee previously can be some of the most challenging ones to review because you don't have consent to fall back on. For those committees who consent to participate in the dummy review exercise, they will then be sent a dummy application with all of the information we would expect to be included in an ethics application that we'll ask them to review in accordance with their standard procedures. That may be by a full committee, it may be by a low risk committee. Essentially, we're asking, do what you would do with this had it been a real application that was coming in to your institution or committee. But we do ask for de-identified minutes to be returned, along with some short questions to allow us to do a content and thematic analysis. Finally, for those chairs and or executive officers who are willing to provide some additional time, we'll do a number of post-review interviews to find out a little bit deeper information about how the discussion went with the committee and what may have transpired down the track at the time that these hypothetical researchers provided a response to any questions raised by the committee. So that's essentially the process. So now the justification, why would we do this? Obviously, this is asking for people's time. We're asking very busy committees to put essentially an extra application on their agenda. So here is my justification for why we think it's important, and I think builds on a discussion of quality that we've had so far in this session. First, it gives us a sense of where we're focusing our attention. It gives us a sense of what committees are thinking about when they're reviewing these secondary sharing applications, which then is important information we can also provide to researchers on things that they really need to be attuned to when they're drafting their applications. And I think all of us have had experiences where we've received applications that sound like there's a useful idea in there, but they haven't actually written about the things we need to see to feel confident that they understand their ethical obligations, that they understand the national statement, and it makes it so much harder to review and takes so much longer to review. It also allows us to quantify what variation there is in decision-making, both variation in outcome, which in some ways is less interesting to me because I think Holly's absolutely right. We haven't drafted a gotcha application. We're not going to mark anyone with a big red cross for saying we think that this would justify approval or we think this won't justify approval. Much more interestingly, it'll tell us about the variation in rationale. What are the particular criteria when it comes to the national statement and, if relevant, privacy laws and guidelines that ethics committees were thinking about? What interpretations do they give of some of those really ambiguous criteria? And what does that tell us for where our ethics committees are sitting in this spectrum of what I'm thinking will be reasonableness? But there may also be some indications of a lack of reasonableness in decision-making. Now, of course, no information is going to be identified. This will all be de-identified information. There is no repercussions for any ethics committee. This is really just to get a sense of whether there are kinds of decision-making that may be happening in an ethics committee that may suggest a need for some additional discussions, some additional resources, some additional education. Okay. So I may have justified the shed to you. The next question is, well, why secondary data sharing? The glib answer would be, well, it's the project we happen to be doing with the ARDC. But I think there's a deeper issue than that, and something that I've been thinking about and troubled by for a while, which is the role of ethics committees when it comes particularly to approving waivers of consent for the sharing of secondary data. Many of you would have heard Mark Taylor talk earlier this morning about the need for trustworthiness when it comes to this role. And what we are imposing on ethics committees is essentially to act as a quasi-tribunal in this space. Ethics committees are given responsibility under our federal privacy laws and a number of state and territory privacy laws to authorise an action that otherwise would constitute a breach of an individual's human right to privacy. Now, at the time these guidelines were written, that was something that the then Privacy Commissioner really commented upon, because the Privacy Commissioner had to sign off on these Section 95 and 95A guidelines when they were first drafted. And the Privacy Commissioner quite openly said, look, this is unusual. I wouldn't normally have thought it appropriate for what is essentially a private voluntary group of individuals to have this level of power. And then made an interesting comment, particularly in retrospect, which was, well, look, I guess there's only going to be a handful of these each year, so it's really not going to be an issue, which now 30 years down the track seems a little naive, particularly as we're starting to see these AI applications and integrations. Given a link to privacy law, there are significant legal repercussions for HRECs and institutions when it comes to authorising these waivers of consent. And finally, waivers of consent and sharing of secondary data provide us with a really lengthy list of criteria that ethics committees need to review, with very ambiguous definitions where those definitions are provided at all. So what's the level of risk to participants associated with breach? We know it has to be low risk to satisfy the criteria. How do we know if it's low risk? The impracticability of obtaining consent. We have almost no guidance in a national statement or elsewhere about how we in Australia should be thinking about impracticability. To what extent can resourcing factor into an impracticability decision? Is it just something being onerous? Or is it that the research simply could not happen at all without the waiver? This one Matilda talked about earlier this morning, whether participants would not have consented if they'd been asked. What does that mean? Does that mean that 50% of participants should have agreed, that a supermajority, like a 67%, should have agreed? Does it mean 99% of them would have agreed if they'd been asked? We have no idea. There's no guidance available to us as ethics committees nationally to help elucidate what's meant by these criteria. And finally, of course, the public interest in the secondary data sharing research, which again, we know can be a really subjective determination. So what do I think is possible to do with the information we gather through this shed process to help move towards some of these indicators of quality that Gordon and Holly have been talking about? First, and really importantly, self-reflection. We don't, in Australia at least, have any clear ways of understanding where our HREC decision-making may fall within the spectrum of other HREC decision-making. We don't have a sense of whether we're being more risk-averse than others, less risk-averse than others, and so we're unable to meaningfully reflect on whether we're still comfortable with the positions that we've been taking. Secondly, it gives us a chance to work on consensus building. Where we see that there is significant variation in interpretations being used by committees or approaches being taken, it then allows us to come together, potentially through the chairs mechanism that Gordon mentioned or some other way, to work on consensus building. We do a lot of consensus building with HRECs. It's the whole process that we use for our deliberation. So why couldn't we use it here too, between committees, to say, well, look, here's somewhere where we're diverging. Can we come together and build an agreement that all of us feel sufficiently comfortable in that we can then take it forward. Finally, it gives us a sense of the questions on which we most need guidance, particularly where we might most need guidance from consumers, where we can understand where our hotspots are, where it seems like we have significant divergence. That might be a cue for us that we actually need to do some deep deliberation with consumers to help guide a way forward that ethics committees might adopt. So that is essentially the process. I would love for as many committees as possible to participate. Invitations will be sent shortly by email to those executive officers listed on the NHMRC registered HRECs list. But please do contact info@ctiq.com.au if you would like to be kept up to date, and I can send you emails personally. And of course, I want to acknowledge the work that's been done by the project team and the amazing advisory committee that has helped move this project forward.
Okay, Lisa, while you're still there, just a quick question. I guess we don't have very long, but I mean, a couple of questions have been raised in the chat about will ethics committees treat it properly? Won't they just be on their best behavior? And I have a response to that. But what are your thoughts about how you can encourage ethics committees to take an approach which enables it to be, something that is a meaningful exercise?
Want ethics committees on their best behaviour? The best comparator we can have is ethics committees being as deliberative as they can be, as thoughtful as they can be. That's what's going to guide us in terms of where our areas of variation are. I'm not interested in tripping up HRECs in terms of, aha, you did a bad job. That's not the goal at all. I want HRECs being as thoughtful, as deliberative as they can be to guide us on where those real hotspot areas are.
Yeah, and it did occur to me that I mean, if you ask the question in the form of, what are the major ethical issues, what part of the national statement is relevant, etc., then you're actually grounding it to an authority that is objective as opposed to subjective, and so I think those concerns aren't really as relevant as they would otherwise be. Question.